This is Science News coming to you from Dallas at AHA Scientific Sessions 2013. I'm Dr. Greg Fonarow, and fortunately joined here by Dr. Chen from the Mayo Clinic, who will be presenting the ROSE-AHF trial here at Sessions. So tell me a little bit about this important trial from the Heart Failure Network.
Yes, previous small studies have demonstrated that low-dose dopamine may have renal selective actions and may improve renal function and enhance diuresis in patients with acute heart failure. And we learned from the ASCEND study that naseritide, when given at its standard dose, does not improve renal function or clinical outcomes. But there have also been small studies and preclinical studies to show that low doses of naseritide, which is less hypotensive, may be renal specific and enhance renal function as well. Hence, the objective of the ROSE-AHF study is to test these two independent hypotheses actually. We hypothesize that as compared to placebo, either low-dose dopamine or low-dose naseritide would enhance diuresis and preserve renal function. And to make it very efficient, we basically have combined two studies into one so that we can recruit less placebo patients and still have the power to compare between the three groups actually.
Excellent. So what was your primary endpoint and what were the findings?
Sure. Our co-primary endpoint was 72-hour cumulative urine volume as an index of decongestion and change from baseline to 72 hours in cystatin C as a measure for renal function. Yep. And what we found was that as compared to placebo, neither low-dose naseritide or low-dose dopamine had any significant effect on 72-hour cumulative urine volume or 72-hour change in cystatin C from baseline.
So these patients were all on a background of loop diuretics and their oral heart failure medications as well?
Yes. So these patients are patients who have been admitted with acute heart failure. Their estimated GFR is between 50 to 60, so they have significant renal dysfunction. And their furosemide therapy was standardized for the first 24 hours based on the dose study that the Heart Failure Research Network did. We gave them at 2.5 times their outpatient dose.
Were there any differences by subgroup, perhaps for the patients with heart failure and reduced ejection fraction compared to those with heart failure and preserved ejection fraction?
Yeah. I just want to make it clear that the ROSE-AHF study was not powered to look at these subgroups, but we did look at these pre-specified subgroups, and there was suggestions that when we looked at patients with preserved EF versus reduced EF, that there's a differential effect. Specifically, in patients with preserved ejection fraction, if they receive low-dose dopamine, the urine volume was less than placebo. Now, in the naseritide group, patients with reduced ejection fraction had a trend for greater urine volume and a lower change in cystatin C as compared to placebo. So there is indeed a suggestion that patients with preserved EF and patients with reduced EF have a differential response to both dopamine, low-dose dopamine and low-dose naseritide.
So with these overall findings, the message to clinicians taking care of heart failure patients that may currently be utilizing low or so-called renal dose dopamine or may be starting low-dose naseritide in these patients, what's the message?
Yeah, I think the main message is that if you use, we should not be using both of these medications to enhance renal function or to enhance diuresis in this unselected group of patients. And of course, because of the fact that we really don't have any medications that could enhance renal function in acute heart failure, we will have to use individual medications based on individual patient circumstances and see whether it's appropriate to use.
So what's next for the Heart Failure Network?
Well, we have about 5 or 6 studies ongoing. both in systolic, diastolic function, both in systolic and diastolic heart failure. And so we are excited, and we're excited to carry on performing these studies that will potentially impact clinical practice.
Excellent. Thank you for sharing the results of ROSE-AHF.
Thank you.
And this has been Greg Fonarow for Science News.